Hi everyone, my name is Cynthia Duke, and today I will be discussing for my nutrition class, nutrition during pregnancy, and how that does, or what that does for the baby, either negatively or positively, depending on what the mother does in order to enable healthy living, healthy diets, and healthy lifestyles for the baby while he or she is growing in the womb. So right off the bat, I want to discuss about feeding for two. So as soon as a woman is pregnant, the mother is immediately feeding for two. This means that she must intake a lot more calories in order to satisfy both herself and the child or the fetus while it is growing inside of her. It means it is very important that the mother consumes proper nutrients in order to make both the baby and herself healthy during this very important time of life. So right off the bat, we know that the growing baby requires folic acid in order to develop properly. Folic acid includes leafy greens, spinach, avocados, broccoli, asparagus, oranges, bell peppers, etc. Things of those nature. And the reason this is important is because obviously the baby requires this in order to grow properly. It alleviates birth defects and things such as that. And if you can look below, I have a picture provided of different fruits and vegetables that also include folic acid that would be helpful for women while they're pregnant. Calcium is also a very important factor that we must take into consideration while the mother is pregnant. So in order to develop healthy and strong bones for the fetus, the mother must also include lots of calcium in her diet. Calcium would include things such as milk, cheese, salmon, spinach, and anything in that nature. Another way women can get calcium inside their system if they maybe are having a hard time is if the doctor, of course, says it's okay if they take calcium pills. And these may be another resource for providing calcium to the fetus while the woman is pregnant. So anemia and pregnancy. This is a big factor that affects a lot of women during this time of life. As you can see from the picture below, the different effects of what the blood cells go through. So for normal bloodstream, you can see there's a lot of blood cells, red blood cells, white blood cells, and a lot of platelets. But in someone who is anemic, they have a very small decreased amount of red blood cells, platelets, and white blood cells. And the reason for this is because the blood volume increases as much as 50% while the woman is pregnant. It means these blood cells in the body become diluted. And the fetus, in exchange, must use a mother's red blood cells for growth and development during this time. And as a result, a lot of pregnant women develop symptoms such as shortness of breath, weakness, tiredness, and even fainting sometimes, which can be very bad, very negative effect for the mother and the baby in turn. So in order to prevent these signs and effects of anemia, red meat can be consumed by the mother in order to help. So empty carbs. So while the mother is pregnant, she must avoid lots of empty carbs because it can be harmful to both the baby and to herself while she is pregnant. Empty carbs include sodas, refined sugars, processed meats, and deep-fried foods such as the one I mentioned or I provide in the picture. You can see all those items on there are not good for the baby or herself and can lead to a lot of unhealthy lifestyle choices in the future and a lot of negative impacts for the child. So a good aspect of pregnancy is if a woman exercises while pregnant. Exercising while pregnant can provide lots of help for both the baby and the mother equally. It can lift the mother's spirits tremendously and can help with the baby's growth and development while in the womb. So some exercises or some side effects or symptoms that can alleviate these lot of pregnancy complications can be, it can help boost energy for the mother. The mother can in turn get better sleep, a better night's sleep, or even during the day while she is pregnant. It lowers a lot of risk for pregnancy-related complications. It can reduce pregnancy discomfort because a lot of times a baby will sit in weird positions and weird places, and so doing these exercises can help actually turn the baby depending on what you're doing. For example, if a baby is breached, the mother can actually do exercises that prevents the child from being this way, so it can reverse those effects so the baby is born correctly and not breached, which is when the baby is born feet first instead of head first. It could also prepare for childbirth, so exercising can in turn provide the mother lots of stretching and stuff. A lot of those stretching exercises can help the mother with preparing for that. It really reduces stress, and it can also lift the mother's spirits, which can be very helpful because a lot of times women suffer from depression and other side effects during pregnancy, and a lot of times these exercises can, of course, release the stress and lift the spirits for the mother. It also improves self-image. So, of course, by exercising, you help improve your image and how you look, and that kind of coincides with lift spirits for the mother. And finally, the last thing it could do is get the mother's body back into shape after pregnancy. So while exercising while pregnant, it helps the baby, and then after the baby's born, if the mother continues exercising, it can help her get back into the shape she was. Also, it depends if she eats properly as well. So there are my references for this thing, and I want to thank everyone for watching. I hope everyone has a good one and you enjoy.